Hey guys, it's another day, and I feel okay. I am so thankful to go to work this morning. I'll tell you what, man, I don't like hospitals. I don't like sleeping alone away from my family. I know they don't like me being gone, but I am home and raring to go. I'm going to kick this today. We have the radiation consultation, possibly right direct. I doubt I go direct into radiation, but it's so, the progression is so much, they might just throw me in a bed. I don't know. Who knows? This is going to be pretty aggressive. I know I'm a little worried, but not too bad. We'll get through it. You know, what is there? What's there left that nothing. So we'll probably hit rock bottom, and now we're on the way up. So today, like I said, is radiation day, 2:15 today. I get to go to work first. I like working, to be honest. I do like just sitting around vegging on the tube and stuff, but I really enjoy my job, and it's fun to get out, go to work, and then do this stuff after. So I'll be leaving early today. I got that little headache still. It's back again. It just won't go away, but it will. It'll go away, right? One way or another. All right, guys. So that's the plan today. I'll talk to you in just a few when I get to work and get some stuff done, and then I'll check back in on my way out. So we're here. Got to work today. Yay. It was nice getting. Yes, I said that.
Being in a routine.
Yes. I like my job.
Yep.
So anyway, we're here for the radiation appointment to find out how aggressive they're going to be with me on my 10-day. Well, the doctor I saw recommended 10 consecutive days radiation blast from the machine on my brain or my skull, my spine and body basically, and then move to oral chemo every day, 3 pills in the morning, 6 at night. So I am here back at my original radiologist or radiation oncologist to let him take over, because I wasn't comfortable with some things that I ran into and didn't run into. So anyway, we're here. I'm going to try to record, and I'll put that on here. So we'll be right back. Here we go. We're going in. Have some fun. Get checked.
There you are. I just can't see with my eyes. All right. Have either of you had a positive test result for COVID?
I'm sorry. I got to interrupt. Did you hear the bell?
All right. Have either of you had a positive test result for COVID in the last 20 days? Are you pending any test results for COVID currently? Have you been around anybody with COVID that you know of?
Not yet.
All right, good.
I think we entered the right place, though.
Alrighty. Get your stickers and then I'll set you free.
You can tell. We're waiting. Almost 2 minutes now. I will edit this so it just starts right here. All these pictures are crooked.
That one is for sure.
That one is
It
too.
needs to come up on the left a little bit, doesn't it?
Yeah.
Well, why are you fixing? Who do you think that is?
Jack Veteranio.
I think that's like Rock Hudson or maybe Cary Grant. When did you get your cyber knife done? Was it like
Last year.
during the winter? Or
Yeah.
I was talking to Marcia today. We always have our little chats
Marsha.
whenever the councils are at lunch.
You on steroids, are you?
Yes, sir.
Okay.
I had a lot of inflammation apparently that was causing joint pains. And
Uh-huh.
they put me on the steroids and it really helps.
Okay. So let me try to do your chart here. We will talk.
Sorry I bothered you the other night. I didn't know who did that. I still don't.
It was my colleague who was on call who forwarded me that, so I just did not know what was going on. So anyway, since I saw you last, it's been about a year and 3 months.
Yep.
Okay.
So, you had stage 3 melanoma, right scalp in 2018. 2 weeks later, you had a neck dissection. Then you got nivolumab, who gave 14 cycles, and then this cluster of 2 nodules were seen in the left upper lobe. We got a biopsy of that was positive for melanoma, and then we treated you. Let's put this down. Your last treatment was November 2019, so November 2020. So yeah, a year and what did I say? 3 months? Yeah, just about. Roughly. Okay. And since I elected not to see you back because you were going to be with Dr. Beatty.
Right.
So what has gone on since that time? Did Dr. Beatty continue with the nivolumab?
He did some Taflonar and Mechanist, and I don't know how long did we do that?
Well, you're probably on it for about 3 months with no problems, and then you
Okay,
started
and then I
having.
started developing resistance. My body rejected it, and I had a lot of aches and pains, really hard aches and pains. Anytime I'd do anything, I got really, really weak. Could hardly.
Let me take a look.
Was it affected his eye? His eye started
The
swelling.
iris and lens got stuck together, and it just I had to get steroid drops for that before I could do anything with treatment. And
Just for
Dr. Beatty,
inflammation from the nivolumab? Is that what?
yeah, something was acting. Something attacked my left eye, and Dr. Beatty says we've got to get you off the. Let's just see. It's kind of more preventative because of the BRAF and everything, and we'll see what happens. And then my next scan came in, and that's where we're at right now. After the eye, I had the scan and found liver, both lungs, and since I'm having these mild headaches every day that will not go away, he recommended a second opinion, Dr.
Here.
Oh, okay.
Those studies here, so let me look at the studies here. Let's see. Yeah, I don't know if they call anything in the liver back in May or not. In retrospect, I can kind of see that there was something there. It's very small. So let me, that little area that we've treated, just that scar tissue is stable, but you've got, some tiny, the tiny things in the lung. I see that. They are small, but they're there. Okay, yep. Multiple ones, but they're small, and then and there's this big thing in the left lobe of the liver. And you got this thing in the abdomen here, behind the left kidney. Okay. So there was a period of time when you weren't on anything. You stopped the Talfenir and the Mechanist in August, right?
Yeah.
Okay. And then, let's see, did you have any symptoms relating to your brain, or did he just decide to get a brain
I have a small headache all the time.
headache?
Yeah.
And actually, I don't see any brain stuff.
Right. That's when I went down to
So
Barnes.
he never got anything in the brain.
Right.
Only in the beginning. But
Okay.
This last, he
Okay.
sent me down
So
to.
he sent you down to see who. Let me look at Care Everywhere. Maybe we can find
Yeah.
it here. I see it.
Okay.
Oh my goodness. So then,
So I made the decision to come back to you because of just our experience with, and I'm not gonna, but I felt more comfortable coming back to you to see if you can
Okay.
do this stuff.
MRI brain.
It's just your personality drew me back to you.
Okay, all right. Well, I thank you for saying that, yeah. So my question is, and I don't get, I read his notes and I don't see what his plan is here.
He was talking, shooting me 10 consecutive days, spine and brain, and then moving over to an oral, 3 pills in the morning, 6 at night. He didn't say what oral, but it wasn't going to be Taflin or Mechanist. It was going to be a different BRAF target, though. Continue targeting that gene. And the technicalities, I don't know.
So he had in mind that we give radiation to the entire brain and spine?
I'm not but that's what I understood for 10 shots, 10 days in a row.
He actually handed off, he handed off the care to a different radiologist.
Radiation oncologist?
Yes,
Uh-huh.
and to a different lung specialist. The oncologist said that the specks are in like the webbing of the brain and the
Uh-huh.
protective layer of, so she said the oral medication doesn't really do well with that. So she was talking about doing 10 consecutive sessions of that webbing of the brain and
Uh-huh.
the spine.
The entire spine?
Yeah.
I believe so. And then the other lung specialist, after that was finished, was talking about doing the oral chemo medication again with the BRAF. And I believe she said that it would be in the same family as
Yeah.
what the mechanism Taflin, but it was
Yeah, she did.
a little different. Maybe they would mess with the dosage so it would be tolerated better. And then if for some reason that didn't work, or if it didn't respond well, then he would still have immunotherapy to rely back on as another option.
Okay, so I need to talk to him. Let me just, so you've got a number of tiny little things in your lung that aren't going to cause you problems. You've got a large lesion in the liver and also in just behind the left kidney. Those are, we can watch those to see how you do with the systemic medicine. The thing that is of concern are the multiple small tumors that are in the lining of the brain and spinal cord. You don't have a whole lot in the spinal cord, but you do have a number in the brain. I need to talk to, I guess, this guy, because we can certainly treat the brain in 10 treatments. I agree with that. I think that makes sense. My experience with treating the entire brain and the entire spine is that it's rough to do. It causes some degree of nausea. It completely depletes your bone marrow, because most of your bone marrow is in the spine. And it may be that, in this day and age, since they don't use chemotherapy anymore, just the immunotherapy, that's not as bad as it used to be, but it clearly will reduce your blood counts. So I have a hard time doing, it's one of these things that we used to do many years ago, and it was just so hard to get people through it, and it didn't seem to do any good. So most of us have abandoned that. Treating just the brain is something that we have done. So I need to call him and see if are you part of a protocol or something that he wants to?
No, they don't have any clinical trials available. That's another reason Dr. Beatty sent me down there, was to see if there's any clinical trials to keep going with this, so.
He did, because Dr. Beatty, I think, is wanting to treat it more with immunotherapy again, with a BRAF added to the immunotherapy for the first 4 cycles. But he wanted John to go down for the second opinion to see if there was a trial available, because he didn't want to disqualify him from a trial by doing the immunotherapy first.
Sure, I get that.
So, and Dr. Beatty actually said that immunotherapy is a pretty good treatment for cancer of the brain that responds quite well. Now, this radiology oncologist down at Barnes said no, that it didn't respond well to the
outside
part of the brain,
because of the protective layers or something. It wouldn't infiltrate.
Yeah, I don't know that we know that. I mean, because it's all the same blood supply.
Yeah.
So where are you going to get, I guess the question is, are you going to get the immunotherapy here by Dr. Beatty, or are you going to go back?
No, I'm going to stay here.
I want to stay here with you guys.
Okay.
We feel more comfortable with the treatment plan and.
Well, that makes it much easier then, because now I can just talk to Dr. Beatty and see what he has in mind.
Okay.
Because I was going to talk to him.
Right.
Because we need to.
Yeah, they are the ones that took all the images and put me in the hospital, and so,
okay.
I mean, got me all bled out.
So let me talk to Dr. Beatty.
Okay.
You're taking dexamethasone, is that correct?
The steroid? Yes.
4 milligram
4
tablets?
milligram every 6 hours, but I don't take it 4 times a day.
Okay.
I just take it twice.
Okay.
Yeah.
Do the least amount that works.
I'm feeling really good.
Great.
A lot better than I was.
That's great. Let me go talk to Dr. Beatty then.
Okay.
Thank you.
It's easier to talk to him than. So.
And I do have blurry vision in my left eye now, which is accompanied with the headache.
So this.
My liver?
Yeah, see that nodule? That's the big one in your liver.
Yeah.
Okay. And then you've got, as I go down here, see there's your kidney, and here's this mass behind the kidney.
Oh, wow, okay.
There it is there. So those are the 2 big ones that you have, okay. And then in the lung, you've got a whole bunch of little ones, that none of which really are very, see that little tiny one there, and there's a little itty bitty one there, and there. So you got a lot of them in the lung, but they're small.
Right.
And this is what we've treated, and it's been got some tumors in the brain, and they're not in the substance of the brain, they're in the lining of the brain. None of them is too big. I think the biggest one that I saw was maybe about that size. Got a number of rules.
Is that my brain?
No, your brain's
You
not
sure
like
that's
that.
not what you found there?
No. I'm not, as a rule, tumor in the lining of the brain and through the spine is a very bad prognostic sign that people don't do well when it is diffusely throughout the lining at all, which is one of the reasons that I have always been very reluctant to do some aggressive, horrible treatment that doesn't work.
Right.
So,
Quality of life.
yeah, I'm all for that.
I don't know. I mean,
We want quantity.
but I am,
But more important,
I'll tell you, I'm strong. I've been through a lot.
I know that, you have.
And, if we have to get aggressive, then we get aggressive.